Welcome to my world. Another day, another time, another period. Our life is for us to gain so much knowledge in it, because knowledge is power, health is wealth. The more we know, the better quality of life we attain. Today's topic has to do with stress, lab tests, and what we need. What is our stress level? Majority of people believe that stress is meaningless. We are all experiencing stress one way or the other. But the way we cope with it is another matter. But that is where the danger lies. Because you might think you are coping and you don't know that you are already having something permanent. Because the more it is permanent, there are variables that will check that will now flip over to make your condition what is usually experienced as chronic problems, especially as we grow in age. But there are people who will experience it even early. So the effort I'm putting in today, as we go into the slide section, is to know those variables in our blood, in our system, that we can affect, that our stress really affects and make permanent, and then there is a ton of events which usually present as chronic problems, chronic diseases. So if you like what you are seeing, press the like button, subscribe, and you will be notified every time the new quality production is out. Lab tests. Do you know your stress level? It's a question. So let's know how to know it. Outline. The outline shall start with definitions, kind of stress, indicators of stress, diagrammatic expression of stress, diagnosis, prevention and control. Definition. WHO definition states puts it as a state of worry or mental tension caused by a difficult situation. Stress is a natural human response that prompts us to address challenges and threats in our lives. So it's very natural, and you can express it. It usually express itself at times as a fight or fright, where you cannot jump a 6 foot or even 4 foot. You find yourself jumping even higher foot, up to higher feet, up to 10 feet, 7 feet. These are possibility when you are really stressed and you want to take a flight. There are two main types of stress: the eustress, which is normal stress, which is positive stress, and the abnormal one is the distress, which is negative stress. It could be acute or chronic. Kinds of stress. Physical stress are related to the environment. It could be the sudden heat or cold or high pressure and acid or alkaline. These conditions, they all have effect on the system, the body system. The brain perceives it separately. The sympathetic nervous system sees it and takes a serious response. So the response is usually what affects the body, that you start producing the stress hormone. So physical threats could also appear in the body as itches, but it could be the physical threat when you see a snake, illness, storm, or flying in an air, all kind of stress situation. You can also have the psychological one called the mental emotional stress, which can cause or aggravate many skin disorders, from those that produce itching, tickling, and pains to those that cause rashes and acne. And you find major life events very stressful, such as the death of a loved one. They cause the severe stress. There is also the post-traumatic stress disorder, where it usually have a relationship to a loss of somebody very dear to you that you cannot cope, or a sudden death, and some people will just go into coma because the experience is too much. The shock is too much for them. But some will not happen immediately, or some can continue for a very long period, especially anytime they sense or smell something that will trigger off that traumatic stress disorder. There's also depression. When this traumatic stress disorder becomes regular, it becomes a chronic stress. So one should be mindful of how to cope with it early, so that it does not degenerate to a serious chronic stress depression. There is also bipolar disorder, shifting from depression to mania and back to depression within a course of 10 days or more or less. So we need to look at all this. Indicators of stress. If you perceive a situation as stressful, the hypothalamus region of your brain begins the stress response. It sends a message to the pituitary gland. The pituitary gland then sends a message to the adrenal gland. This adrenal gland is on top of the kidney. It is this gland that releases the stress hormone called cortisol. This is what is measured to know your level of stress. So we now want to do a dramatic expression of what I have just said, and that is, you look at, this is the brain. The sympathetic nervous system will send the message immediately to the brain. The brain will act on it, pass it to the pituitary gland to produce these adrenocorticotropic hormones, which will act on the adrenal gland. The adrenal gland then produces the adrenaline and cortisol. These are hormones that are steroidal. They are steroids. So you can understand their effects on the cholesterol, because the backbone of these hormones they are made from the cholesterol background. And what do the adrenaline and cortisol cause? They cause the whole organ. They affect the whole organ of the body. For example, the heart, it causes increased heart rate, blood pressure, that is the vascular organs, blood pressure increase. The stomach, it decreased digestive system activity. The liver and others, the pancreas, it breaks down, they convert the glycogen to glucose, and dilation of the bronchioli and the lungs. So these are effects that expresses immediately, and if it becomes a permanent, continuous thing, you can then understand that by the time you are taking the blood pressure every time, the person, you can now say is hypertensive, because you have to take the continuous blood pressure to be high before you can declare a person hypertensive. So when this cortisol hormone is recorded high, then you can understand that this is probably the cause of the problem. It's a stress problem. The cortisol increasing the blood pressure is because it affects the kidney to retain sodium in the bloodstream. And once sodium is retained, it will absorb more volume of water. So the heart will now have to have high pressure to really pump the blood through all the vessels to all the cells of the body. So that explains the high blood pressure. The research is also done. Adults with normal found out that adults with normal blood pressure and high level of stress hormone
we are more likely to develop high blood pressure and experience cardiovascular events compared to those who had lower stress hormone levels. So you can see the correlation of the stressor. If it continues, it will make the person become a permanent hypertensive patient. But when it is the low level of the cortisol, then the hypertension will not be. So according to this is found in the published in the Hypertension and American Heart Association Journal. You also have the indication that higher level of the stress hormone cortisol will also linked to an increased risk of cardiovascular events, including heart attacks and stroke. So we are talking of chronic problems, and the cumulative exposure to the daily stressor, when we are talking of the cause, that which continue to cause the stress, and exposure to traumatic stress can increase cardiovascular disease risk. So you can understand now that the stress level is very important for one to know. If it is a continuously high thing, then you probably need to trace your stressor and get familiar with it, or find how to overcome it so that you can naturally reduce your tension. As an adaptive response to stress, there is a change in the serum level of various hormones, including the corticotrophin releasing hormones, cortisol, catecholamine, dopamine, epinephrine, and thyroid hormone. The thyroid hormone, you know, is involved in metabolism, and these you are talking of cortisol. So these are things that we can measure in the lab to exactly know what is your present state. Adrenaline increases your heart rate, elevates your blood pressure, and boosts energy supply. That is has been exposed and explained earlier. Cortisol, the primary stress hormone, increases sugar glucose in the bloodstream, enhances your insulin use of glucose, and increases the availability of substances that repair tissue. Two methods can be used to measure stress. One is the psychological just questionnaire. They fill the questionnaire, and you can be told that the psychologist will really tell you, or the health therapist that has to do with problems will tell you what it is and the treatment. There is also the laboratory aspect, the laboratory tests, which are very competent. Blood tests. A cortisol blood sample is one of the most commonly used blood tests. Higher level of cortisol would indicate higher level of stress. A cortisol test measures the level of cortisol in your blood. We take the serum. High in the morning is always very high. That is common with all these steroid hormones. Urine samples are also collected. Saliva could also be collected, and you must observe what I said. Prevention and control. Loss of regulation by the brain can lead to cortisol excess disorder. So when you have that kind of problem, it's not the situation of the stressor again. It is now the loss of the feedback mechanism that will stop and control it. So that is what is described as Cushing syndrome. Or when the cortisol produces insufficient or cortical insufficiency, such as Addison disease. Also, we must prevent the body experiencing high level of cortisol for a long period of time. That becomes chronic. It can lead to chronic problems, especially experiencing it very early before old age. The stress eventually becomes unhealthy. Over time, high level of cortisol actually start to wear down the brain and other body systems. This type of damage to the brain has been associated with a number of health problems, including depression and anxiety disorder, memory loss, and dementia. Majority of people always want to explain the cause of dementia. This is trying to state clearly that the problem could be a function of cortisol, your stress level. So the stress level is very important for us to, once in a while, measure and know our stress level. Thanks.